This is an audio-visual representation of a study published in the Journal of Bone and Joint Surgery in 2025. Total knee arthroplasty, or TKA, is widely used to relieve pain and restore knee function in patients with severe osteoarthritis. The rising incidence of TKA in outpatient settings underscores the need to assess risk factors associated with adverse outcomes. Although a history of myocardial infarction, or MI, one such potential risk factor, is increasingly prevalent, its impact on the outcomes of TKA remains unclear. To bridge this gap, researchers evaluated the influence of timing, type, and treatment of MI prior to TKA on postoperative cardiac complications, general medical complications, and surgical complications. Accordingly, using a large insurance database, they conducted a retrospective comparative study in which 8,810 patients who had experienced MI within 2 years before undergoing TKA were matched with 34,905 controls without any history of MI. Patients with prior MI were further stratified according to the timing, type, and location of MI, and the treatment received. Patients with prior MI had higher rates of postoperative MI, heart failure, and mortality within 90 days of TKA compared with controls. Further, type 1 MI, STEMI, and percutaneous coronary intervention were associated with elevated postoperative and mortality risks. Notably, patients who experienced MI within 6 months before TKA had the highest risk of postoperative MI. Overall, prior MI, especially occurring closer to the time of a TKA, amplifies the risk of postoperative complications and mortality. Timing TKA after cardiac clearance in patients with prior MI can help mitigate postoperative risks.